And acute abdominal pain is one main objective, okay? So acute abdominal pain is under a set of objectives. So it comes under abdominal pain as an objective. And acute abdominal pain, so you realize that under abdominal pain, we have chronic abdominal pain, we have acute abdominal pain, and then we have abdominal pain in children, and then we have anorectal pain. We've done extensive lessons in these, but because about 45 or 40 to 50% of the cases are on diagnosis and assessment, how can you just put these two and two together to make a diagnosis? That is why we are going back to really pick them one by one and deal with them. So you realize that that lecture I did on abdominal pain, we picked on a particular topic. This time we are looking at all the syndromes which can present so far as the patient says, I have upper abdominal pain. So right upper quadrant pain, epigastric pain, left upper quadrant pain. That is what we are going to deal with. And someone may ask me, okay, Dr. Bruni, what do you mean by that? What do you mean by this thing you're talking about, the distribution of questions? If you go to the MCC's own website, okay, and you click on MCQE1, this is what I'm talking about. Assessment and diagnosis will cover about 45 plus or minus 5. So that means 40 to 50% of the cases you're going to get are going to be on assessment and diagnosis. Why are we focusing on abdominal pain? Because it's an important MCQ1 objective.